I see when we saw you last time, you had some cough with some phlegm in it. And
Doctors and nurses in Shreveport are putting down their pens, abandoning paper charts, and picking up iPads as LSU Health becomes the first statewide public health system in the country to switch to electronic medical records. Known as the PELICAN system, paid for with more than $144 million in state and federal funds, it was more than 5 years in the planning.
This will give doctors better tools for taking care of patients, and it will give patients better tools for monitoring their own health care.
Ultimately, PELICAN will provide instantaneous, secure access to medical records, including lab tests, prescriptions, treatment, and patient histories.
Any patient who comes to a system now will have access to their medical information in anywhere within our system within Louisiana.
Following Hurricane Katrina, when hundreds of patients had to be evacuated from New Orleans without their paper records, many ended up at hospitals and shelters where physicians didn't have any information about their medical conditions.
The patients had no idea what medicines they were on. They often didn't know a lot about their past medical history. And so we had to try to reconstruct this based upon incomplete information.
Now, every entry on a patient's record will be immediately available to all caregivers.
The single entry into a single integrated database allows information to be shared by all clinicians simultaneously. So a physician can write an order, and that order is available to be acted upon by a nurse instantaneously.
Initial deployment of PELICAN covers LSU medical centers in North Louisiana. LSU hospitals and clinics in the South, including New Orleans, are expected to be connected to the system by the end of the summer. For 3-day-old Skylar Smith, who was the first baby born after the system went online, PELICAN means it's likely she may never know what a paper medical record is and how her birth records can be found in just a few clicks.
You don't have to fill out so much paperwork, sign this, sign that. You know, you just come, give name, date of birth, and they pull everything you need right up for you.
This is Dr. Lee Vinokur reporting.